It used to be a stigma that adults thought that braces were for children only, but that is not the case anymore.
You know, adult treatment is incredibly rewarding for me. You know, the adults come in, they have specific needs, they're into the treatment, they do exactly what we ask them to do, and it's fun to share the change with them.
There's no question that the catalyst was when we started to bring him here. That just kind of got me in the door. The initial step of getting in here and seeing how the whole thing worked caused me to say, okay, this is it. If I'm going to do it, it's going to be now.
I do a lot of public speaking and in front of crowds a lot, and I just thought it would give me a little bit more confidence. Having the straight teeth and knowing that they look good, and I'm so pleased with how they look, it does make you just want to smile.
The technology has improved where you have cosmetic braces, where you have the eye braces, the braces behind the teeth, where you have Invisalign, where you are able to basically wear what you call aligners, like mini retainers, to be able not to have to wear braces.
It made me feel really good, made me have a bigger smile and actually see more teeth than just two front teeth.
She would smile, finally. We could get her to smile for us.
You know, there are so many different treatment modalities available for our adults today. I would really encourage any adult to come in and at least let us show you what's available. I think you'd be shocked at what's available out there today.
I started my treatment in May of 2005, and I was 35 years old then. I'd had a couple of instances where the dentist would refer at an earlier age, and the treatment that they had at the time was pretty invasive. In fact, Dr. Goggans at one point told me that I probably needed oral surgery.
Greg came in with just a really underdeveloped upper arch, and his top teeth were way inside of his bottom teeth. And I think Greg had seen both Dr. Goggans and myself, and we had both told him that the only way we could really treat him properly would be for him to go through orthodontic surgery.
That was about 2003, and then 2005, Dr. Fender called me back in and said, hey, we got a new thing called the Damon bracket system, and it's a new type of treatment, and he thought that may work in my particular case. It's amazing how the system works, just a tremendous difference in the appearance and even the jaw structure, everything.
Greg ended up coming in, and we were able to treat him, and we were able to achieve some incredible results without any surgery at all. You know, I think one of the things that we've tried to do is really stay on top of technology and are willing to try these new technologies to make sure we're providing the best orthodontic treatment we can for our patients.
Give me a lot more confidence, really. You know, not afraid to smile, not afraid to you know, carry on a conversation face to face. Don't mind looking someone in the eye anymore. So it's a good feeling.
Age has nothing to do with it from a standpoint of receiving orthodontic treatment.
You know, one of the great things about orthodontics is oftentimes we get adults in their 60s and 70s, and you know, and some people say, well, why are you here? And it's never too late.
I would encourage anyone, if they're, you know, if they have an issue with the jaw alignment or whatever, I mean, all those things can be treated effectively and relatively quickly as well.
Even though I thought I was too old for braces, I've seen several people that were 60s, and even some. I went to church with a lady that was in her 70s, and she's wearing braces now. So I don't think you're ever too old to improve your smile.
Thank you. You're welcome.